Hi, everyone. Thank you for joining us today. My name is Rhea Racho. I'm with the Hepatitis B Foundation, and we're excited to present today's webinar on increasing hepatitis B awareness and education among nail salon workers. I'm going to start things off by reviewing a few logistics and details on how you can participate in today's webinar. So first, if you have any issues with your computer audio, you can always dial in using the phone number on the screen. Just as a note, all participants are in listen-only mode and will be muted throughout the presentation. If at any time you have any questions, you are welcome to submit them by typing them into the chat box in your GoToWebinar control panel. We'll be reviewing all questions as they come in, and we'll address as many as we can during our Q&A time at the end. Also, given today's topic, if any of you are working currently on hepatitis B education initiatives among the nail salon community, we would love to hear about what you're doing. So if you'd like to send us a note in the chat box and let us know where you're from and what you're working on, we'd love to hear those comments. And the last note is that this webinar is being recorded. So after this is over, you'll receive an email with a link to view and share the recording, as well as a copy of all of the slides. So today's webinar is hosted by Hep B United and the Hepatitis B Foundation. Hep B United is a national coalition that was co-founded by the Hep B Foundation and the Association of Asian Pacific Community Health Organizations, or APCHO. We are a national coalition dedicated to reducing the health disparities associated with hepatitis B by increasing awareness, screening, vaccination, and linkage to care for high-risk communities in the U.S. And the Hepatitis B Foundation is a national nonprofit organization dedicated to finding a cure and improving the lives of those affected by hepatitis B worldwide. Our speakers today are Eugene Ng, who was a fellow with the Hepatitis B Foundation this past summer. He was selected for a health equity fellowship with the Office of Minority Health. And so we're lucky to have him over this summer working and really leading the research around hepatitis B education and awareness efforts in among nail salon workers. And so he's going to be first on our agenda, sharing sort of the background on his project and some of his findings. And then we will transition to hearing from Lisa Fu, who's the director of the California Healthy Nail Salon Collaborative. And finally, we'll hear from Soon Mon, who's the Refugee Health Program Coordinator for the Tacoma-Pierce County Health Department in Washington State. So at this time, I am going to turn it over now to Eugene to give us sort of the landscape of the nail salon industry and policies, and why it's so important that we address hepatitis B among this community.
Great. Thank you, Rhea, for that introduction. And so just like Rhea said, I'll be giving an overview of the different policies and regulations in the nail salon industry and how they're affecting hepatitis B awareness, education, and prevention efforts. Next slide, please. So I'll first start off with some background information on this workforce. The nail salon industry is about an $8.5 billion industry, and the average worker makes a median income of around $23,000, which in the grand scheme of things is quite low given the long work hours that these workers are subject to. A lot of them are working over 40 hours a week, and so they are often, unfortunately, the victims of worker exploitation and things like that. And if we look across the U.S., there are around 440,000 licensed nail techs, with approximately 56% of them Vietnamese. And so we do see that the majority of this workforce is of Asian descent or are Asian immigrants, with 97% of them being female. Next slide, please. And so if we look further into the distribution of the nail techs across the US, we see that most of or the top 3 states that have the highest concentration are California, Texas, and Florida, with the rest or the majority of the other nail techs mostly residing along the East Coast and other portions of the West Coast, with much fewer in the Midwest and Colorado Rocky region. Next slide, please. And not surprisingly, if we look at the Vietnamese population in the US, they're also heavily concentrated in those 3 states, California, Texas, Florida, and in addition to that, Washington State, where we do also see the greatest concentration of the nail tech workers. Next slide, please. And if we look further into the age distribution of the nail salon workforce, we see that the majority of nail salon workers are under the age of 50 and of reproductive age. And so if we look at the immigration status with most of the workers immigrating from Southeast Asia, and given their Asian descent, this puts them at a higher risk for hepatitis B transmission between workers in the workforce and also with their clients. And then in addition to that, given the reproductive age that most workers reside under, this puts them at also a risk for perinatal transmission of Hep B. And that's why education and further awareness of Hep B in this workforce is absolutely critical and will be very essential to preventing Hep B transmission horizontally and also perinatally. Next slide, please. And so within the nail salons, they're all governed under a state board of cosmetology, which is run by and differs between states. And the state board of cosmetology regulates these nail salons by enforcing and implementing new policies. And in addition to that, they control the licensing for all nail techs. So in order to work in a nail salon, an individual has to receive training from often at the School of Cosmetology, and then also pass a licensing exam to obtain a nail tech license. And so if we look more specifically at the curriculum that these workers have to train under, the curriculum consists of both a theoretical aspect and a practical aspect, where they're getting trained in, for example, if it's sanitation, specific infectious diseases that they may encounter in the workforce, as well as other chemical exposures and other hazards. But then to go along with that, there's a practical portion where they're getting hands-on training on how to protect themselves and protect their clients. And if we look at the number of hours of training that are required between different states to obtain a nail tech license, it also differs and it varies greatly. There are some states that require just a few hundred, like 100 or 200 hours of training, whereas there are other states that require close to 1,000 hours of training. And if we look even more specifically at the types of infection control that's required to, that trainees are required to undergo, there is a lot of, there's a lot of variation in there as well. So there are some states, for example, like California, that are very good at delineating very specific diseases that trainees have to be educated about. For example, Hep B, Hep C, and HIV, and a few other specific infectious diseases, where there are other states that don't delineate these specific infectious diseases that a curriculum has to cover. And then finally, there are also very few states that require continuing education for nail salon workers, specifically in the field of sanitation, to stay up to date on the best practice to protect themselves as well as clients. Next slide, please. And so next, we'll talk more about the barriers that these nail salon workers encounter in not just getting adequate training, but also accessing healthcare. And the number one concern is language. Because a lot of these workers are immigrants and they come from, the majority are coming from, for example, Vietnam and other regions of Southeast Asia, they have limited English proficiency. And whether it's training under the cosmetology schools or speaking to a healthcare provider, language is a major barrier. In addition, there is oftentimes minimal to no insurance coverage, health insurance coverage that these workers have, which makes the cost of accessing care, it puts a great burden on the families, and thus it poses an extra challenge for them when trying to access healthcare. And in addition, there's also a general mistrust in the government, especially in the Vietnamese immigrant population. Because of their immigrant status, there is fear of deportation and other issues. And then within this population, there's also a lot of confusion between the different types of hepatitis. So hepatitis B, C, and A, there's often confusion and misconceptions on how these different forms of hepatitis are transmitted and the different symptoms and how they present. And finally, there is also high worker turnover in this workforce, which makes outreach and education very challenging. Next slide, please. And in terms of the state board policies, Connecticut currently has no governing board for nail salons. So to work in a nail salon, you're not required to obtain any type of formal training or licensure. So basically anyone can walk in and start working there. And if we look at Utah, they have no specific regulations for sanitation. And so they, even though OSHA does set guidelines that everyone must follow, at the state level, they don't have anything specific that really requires a protocol for workers to follow in terms of sanitation. And again, there is great variation between the states. So a lot of states are very good at delineating a specific sanitation protocol, which works very well. And there are other states that leave it very open-ended. And that variation makes it also very difficult for these nail salon owners to follow. Next slide, please. And so to further look at how effective a state was at implementing or protecting workers and clients from an infectious disease, we looked at whether or not a state required the use of an EPA registered disinfectant that was hospital grade and able to protect and kill the hepatitis B virus. And if we see here, the majority of states do have a requirement for an EPA registered disinfectant. However, there are some states that still don't require that. Next slide, please. And then furthermore, if we look at whether or not states have a specific blood spill protocol, there is still a significant number of states that don't list out a specific protocol for workers to follow when they come in contact with blood to protect both them and the worker. I'm sorry, them and the client. Next slide, please. And so finally, this leads us to an issue of institutional discrimination that we came across, where in 4 states, Texas, Oklahoma, Arkansas, New Jersey, individuals who are infected with Hep B are actually barred from working in nail salons, which is clearly a form of institutional discrimination that is preventing these individuals from working in the nail salon. Next slide, please. And furthermore, there is some concerning language and policies that other states use to maybe not outright prevent these individuals from working, but have language that's very concerning. So in Alabama, Hep B, workers who have Hep B are required to disclose their status to all coworkers and all clients that they come encounter with. And that's clearly a violation of HIPAA. And then in areas in DC, Montana, and West Virginia, workers are required, or applicants who are trying to apply for a licensure are required to disclose their Hep B status. And then they are handled, quote, on on a case-by-case basis. Next slide, please. And so this leads us to what can we do as community organizations and health organizations to address these issues. And we look at the state of Oregon, they have a really, I think they had a model system where prior to 2013, they had language in a policy that specifically called out individuals who were infected by an immunodeficiency disease like HIV or hepatitis B, C, or D. And they, in using this language to isolate these individuals, it was a form of potentially allowing for discrimination of these workers. And so next slide, please. If we look at in 2013, the state board actually ruled to repeal that language in their policy, and where they cited the American with Disabilities Act, which prevents any state from barring an individual from practicing cosmetology based on an individual's communicable and bloodborne disease status. So even though these policies are in place in Texas, Arkansas, and New Jersey, there are efforts that we can take to really implement change in these policies. And so with that, I'd like to introduce our next speaker, Lisa Fu, who is the director of the California Healthy Nails Salon Collaborative. And she can talk more about the successful program that she's implemented in California to really help address this issue. Lisa?
Great. Hi. Thank you, Jean. Hi, everyone. Thank you for having me. Again, my name is Lisa Fu, and I'm with the California Healthy Nail Salon Collaborative. And this slide shows our mission, which is to improve the health, safety, and rights of the nail and beauty care workforce to achieve a healthier, more sustainable, and just industry. We were founded in 2005 out of a health clinic in Oakland, Chinatown called Asian Health Services. And our Vietnamese health outreach workers were doing outreach to the Vietnamese community around health issues such as diabetes, cancer screening. And in order to reach the Vietnamese community where they're at, they were actually going and providing education in nail salons to workers and owners. And the folks that they were providing outreach to said, you know, we think that we may be having health issues because of the products that we're working with. And obviously, you know, like Eugene said, you know, working in the workplace for so many hours a day, you know, being exposed to the various chemicals and ergonomic issues and workers' rights issues. So that's kind of how the collaborative was formed, kind of organically from the ground up. And since then, we have done a lot of work specifically around policy advocacy, research, and outreach and education. And we are a statewide coalition, and we also do run programs as well. And our coalition members that are organizations include public health and environmental justice advocates, women's rights, women's health organizations, Asian and Pacific Islander health organizations, reproductive justice, workers' rights groups. So obviously our work is very intersectional, and so we have a lot of different organizations that are part of our membership. And then we also have members that include workers and owners themselves that are interested in wanting to be a part of the leading the way in terms of really trying to make changes and improve the industry. Next slide, please. Just a brief overview around the California specific demographics of nail salon workers. So in the state of California, that's where we have the highest number of manicurists and cosmetologists. We have over 336,000 across the state. And across the state, 67% are Vietnamese. And in regions where there's actually high populations of Vietnamese folks, like in Santa Clara County, which includes San Jose, and Orange County, which includes Little Saigon, the percentage of Vietnamese, the percentage of nail salon workers that are Vietnamese goes as high as 85%. And so, like was mentioned earlier, most are recent immigrants, limited English proficient, women of childbearing age, and having average income of $21,800 a year. So definitely low income. Next slide, please. And among some of the health issues that we've come across when talking with folks, and then also just hearing about our from our research advisory committee around the chemicals that they're working with and how they're connected to various health issues. So we are familiar with these health concerns that the population has been experiencing, including reproductive health outcomes. So for women who are trying to get pregnant, who want to be pregnant, having a hard time or having multiple miscarriages, sometimes even stillbirth, various cancers, ergonomic problems from just repetitive motion around, for example, bending over to also filing nails and, a lot of ergonomic issues around the back, shoulders, and wrists. The chemicals that they're working with also are connected with respiratory illness and various skin irritations too. And in addition to health concerns, I just wanted to also remind folks that the nail salon community also does experience workers' rights issues as well. And so that's something that we're working on in addition, just to make sure that labor laws are being followed and workers are able to work with dignity. Next slide. So like I mentioned before, at the collaborative, we have 3 different strategies in terms of how we do our work. And so the first one is leadership development, and that includes doing outreach, providing trainings to our workers, and also doing leadership development. So actually trying to really center our work so that the voices and experiences of the nail salon workforce themselves is a part of the other pieces of work that we do. So they're engaged in our policy advocacy work. We have done policy and passed bills and supported bills in California and in DC as well. And in addition, we engage the membership around research, specifically community-based participatory research efforts that really help to lift up and share and show more some of the health impacts, ways, best practices, ways in terms of providing trainings and for workers and owners to retain information. Next slide, please. And so just to highlight the first strategy that we have, which is around leadership development, that includes, like I mentioned, health, safety, and workers' rights trainings. And these are some of the modules that we have, and I wanted to just share and go over with you. So we have trainings about gel nails, which has been much more popular over the last 5 years or so. Healthy nail salons, green tips for your salon, infectious diseases, and workers' rights. And so for us, when we talk about hepatitis B, that's incorporated into the module specifically around infectious diseases. And we find that it's a really important and relevant topic during our trainings. It's actually one of the more popular topics in our trainings, since a lot of the workers really resonate with it. They actually have hepatitis B themselves, or they know someone else who does. And so when we're providing the trainings with them, it's really clear that there's a lack of understanding and education when it comes to hepatitis B. So that makes it even more important for us to make sure that the information is shared and available for the community. Most of the workers who may have it, they may not know that they have it because they find out that there are not always symptoms. And so one of the outcomes that's been great for us is that some of the trainees have followed up with us and said, yeah, I went to my doctor and I went to get a blood test, or I want to go to, or I'm planning to go, or I want to go to my doctor and get a blood test to find out if I have hepatitis B. And then they know, from the education that we're providing is that if they don't have it, that they actually can get a vaccine to protect them. I think one thing that's important too around providing the information around Hep B to this workforce is that the information needs to be shared in a way that's really engaging and interesting. I think it's with everyone, right? With anybody, information needs to be relevant, or else it's hard to retain that information. And so we really adapt it in order to make it appropriate for our particular audience of nail salon workers. And so, for example, for manicurists, when we talk about hepatitis B and we include that in talking about when we talk about infectious diseases. So we talk about it specifically, like what can you do while you're at work? Washing your hands, making sure that you disinfect your tools and clean your workstations before and after each client. We talk about disinfectants and how long, needing to be tools needed to be submerged in disinfectant for at least 10 minutes. Also letting them know that, sometimes clients bring in their own tools. And so we let them know that that shouldn't be happening and they shouldn't be using clients' tools. And if there are any non-metal tools that are used, for example, emery boards like nail files that are non-metal, to discard them, or they can give them to their client after each use, and just to ensure that they're not reusing them. And so I think making sure that we talk about the work and talk about hepatitis B in the context of our work is really, really important. Next slide, please. So just to share an example of one of the programs where we share the infectious diseases model and provide that training is with our Healthy Nail Salon Recognition Program. And so this recognition program has been adopted by 4 counties and cities across the state. And essentially, it's a voluntary program that recognizes nail salons that commit to adopting safer practices. And so that includes using, like the list here, there's a list of 9 different things. So that includes, for example, using nail polishes that don't have the toxic trio of chemicals, which include formaldehyde, dibutyl phthalate, and toluene. Use safer polish removers, avoid using thinners, wear nitrile gloves, have ventilation. Next slide, please. Install mechanical ventilation units, use safer artificial nail products, train all nail salon staff on safer practices. So that includes the Hep B infectious diseases piece. And then the last one is do not allow customers to bring in products that includes the tools unless they meet the program's criteria. And so this is just one example. We also provide trainings where workers receive Hep B information, general health and safety trainings that we provide for free to the community. So this one, for example, was for the Healthy Nail Salon program. And we also provide the Hep B information during our leadership development trainings as well. Next slide, please. So like I mentioned, we have the program in 4 cities and counties, this Healthy Nail Salon program in 4 cities and counties across the state. And so there are approximately 200 healthy nail salons in California. And we're currently working with the State Department of Toxins and Substance Control to really help to provide information and education to counties across the state to really try and implement the program. So hopefully it can be dispersed throughout the state and not just isolated right now, at least to this 5 regions. Next slide. So that's all I have right now, and I'm happy to take any questions about the work that we do.
Great, thank you, Lisa, for sharing with us about the California Healthy Nail Salon program. Next, I'd like to introduce Swan Man, who is the Refugee Health Program Coordinator at Tacoma Pierce County Health Department, and she'll be talking more about the efforts that she's had in reaching out to the Vietnamese community that she's very much involved with. Sun?
Thank you, Eugene. Hi, thank you for having me sharing our work with you today. And next slide, please. These are the items that I will go over with you in the next few slides. So next slide, please. We would like you to know that the work we do here in our county is a collaborative effort. So we, Tacoma Pierce County Health Department, work to protect and improve the health of all people and places in our county, and that is our mission. So also we have a long and productive relationship with the Hepatitis B Coalition of Washington, with many projects about Hep B and providing outreach into the AAPI community, including the Vietnamese. We also collaborate and partner with primary care providers in our county to promote hepatitis B education, testing, and vaccination in the AAPI communities. Next slide, please. Before I present you about the nail salon project, I'd like to talk a little bit about the community conversation, or we call the talking circle, that we convened in late 2009. The goals are to engage the Vietnamese community members, to assess the awareness and knowledge of their hepatitis B, to identify barriers, needs, outreach strategy, and to identify other opportunity for future collaboration. Next slide, please. How did we do this? So we rely on our current relationships to recruit the participant. We made phone calls, we sent invite letter to 15 community members, and we try to bring them into the circle, talking circles, so that they can share their perspective about hepatitis B. Next, please. So in June 2010, we reported back to this group. We invited them back, and we thanked them for participating in our meeting. And we asked them if they would like to work with us to spread the word about hepatitis B in the Vietnamese community, including friends, family, etc. So out of the 15 participants, we have 7 who happily agree and committed to be the member of the engagement group. So next slide, please. So I'd like to introduce you to our Hepatitis B Vietnamese Engagement Council. There are 7 of them, plus me, myself, as number 8. So this is a picture that we took when we first started the council. And next slide, please. So now it's about the hepatitis nail salon outreach project. Why nail salon workers? Like Eugene and Lisa spoke about the importance of reaching out to this population, because a lot of them come as new immigrants, and a lot of them are younger men and women, especially with the women at childbearing age. So we wanted to do this project in the nail salon worker. The goal is to increase the awareness of chronic hepatitis B, to provide Hep B educational materials, Hep B testing and vaccination, and if needed, we will provide links to care for clients with positive hepatitis B virus. So we have the planning and the activities going on early 2012. We consider the council, the engagement council, to be the key contact for this project. We were lucky because there were 2 of the council members who happened to work in the evening, so they were free during the day to do this project for us. So their job is to make the visit at a nail salon worker anywhere that have the Vietnamese worker to work. Not just the nail salon. We are saying the nail salon, but anywhere they could go, and they can go to a grocery store or their churches or temple. They can promote this by distributing the flyer of this project. Okay, next slide, please. So the activities for the council members included the training. They are trained for basic hepatitis B 101. We call 101 because they need to know what's going on about hepatitis B. And they are the one who deliver the key messages to the salon staff. And of course, they came out with me for the first few visits to visit the nail salon. And of course, they work with us to divide the work. And you know, nail salon are everywhere in our counties. Therefore, they have to divide their work according to the map and according to the locations. After that, they made the visit on their own, and they were able to provide hepatitis B education materials and the flyer that include the information to call the health department for an interview, for an appointment. And that is to refer them back to us, to the health department. Next slide, please. Only one day after the visit, they made the visit, we received the phone calls. I myself was the one who received the phone call, made the appointment for the salon's worker to come in and for the interview. And then after the interview, we would refer them for testing. And the plan is, if after the test, the result come back to us, we will make the call to the client and to provide them either the copy and over the phone call, but then they will come in for the copy of their result. If anybody needs the vaccine, the whole department nurses will provide the vaccine to them. And if what the plan is, with any positive hepatitis B result, we will refer them to a primary care provider for follow-up. And of course, our job was to report back the activities and outcome to the Hepatitis B Coalition of Washington. Next slide, please. This is the outcomes of our project. Our council members were able to make 203 visits to the nail salon. We, the whole department, interviewed 143 clients. And you can see 92 women we interview and 59 women are at childbearing age. And we were able to refer 135 clients for testing. There were 8 of them that come to us and they show us the test that they had with their providers. So we interview 143, but we also we only refer them out for 135. Next slide, please. From the testing, these are the results for our tests. We were able to identify 8 positive for hepatitis B. We were able to refer for care and follow-up 5. There were 3 that refused the care because they didn't want to pay for a nominal fee. That is the office visit with the primary care provider that we work with to follow up with them. And 72 show the immunity and 63 need the vaccine. We were able to complete the vaccination series, 59 of them. And 4 we lost to follow up because they moved out of the county, and a few of them are from another population, not the Vietnamese. Next slide, please. Yes, of course, we had challenges at the time. For example, according to our council member, the visit to the salon may early during the day because we wanted to make it more convenient for the owner and also for the salon worker. If you come early, the customers are not there yet, and you will be able to provide the information to them. And another challenge we encounter, that is salon worker not available at all time. Salon owner were sometimes not cooperative or responsive. So it expected, you know. So, and then of course we have those positive clients with hepatitis B. refuse linked to care. Next slide, please. But more successes, as we have 94% completed the series of vaccine. That is, we were so happy about that. And after that, the clients refer their friends, families to the health department for testing and vaccination. We have the advantage of the Quest Diagnostic is right across the street. So early in the day, the nail salon worker come in to see me for the interview. I refer them out for the test. They just went across the street for the test, and then they go to work. They went to work after that. And after that, of course, the Hepatitis B Coalition of Washington presented our project, national and statewide, for what we did with this project. Next slide, please. After June 2012, one of the other things that we noticed that we continue receiving call for interviews and referral for testing. People didn't quit. People didn't stop right after June 12, because our project with the coalition at the time run from February through June 2012. And we stopped right there, but still people continue calling in, and we were able to bring them in for more testing and refer and vaccination if needed. We also were able to counsel more patients that we identified with positive hepatitis B. And of course, with that linkage to care, it's important that they have a doctor to go to for follow-up. Remember, before we keep calling Obamacare, because before at this time, we don't have that system medical coverage yet. A lot of immigrants, Vietnamese, they don't have medical coverage. Therefore, having to identify positive hepatitis B and having being referred to a provider for care and follow-up is important to us. Next slide, please. To us, this project model could be replicated to other populations or community. If you know your community, you can do that. And of course, after this project, we did more educational community events, and then another project in the nail and hair salon, and we focus more in the restaurant business. If you notice, the Vietnamese work in the restaurant business a lot too, and even in the Asian stores, for example. Another thing is that we continue to meet. I led this council, and we continue to meet to share information about what's going on, about what the coalition could do, could give us more for more project in the future. So that's the important thing, that we could do that. Okay, so from this, I'd like to share what we learned from this project is that, number one, know your community. It's important. You know what they do, what kind of work they do, then you will be able to replicate this model in your community, your population. Have trust. If you don't have trust in your community, you will not be able to do this kind of work, because it's related to medical issue, and that if we do that, they will trust us and they will come to us. Educate and educate. That is what we need to focus more. If we don't have a project, but we need to find a way to continue educating our community about hepatitis B. Thank you.
Great. Thank you, Soon, for for sharing with us the successful project that you had in Tacoma Pierce County in Washington. And so I'd like to wrap up and conclude and bring together the thoughts that Swoon and Lisa had shared with us to provide some further recommendations and kind of next steps on where we can move forward in terms of our efforts to really help address hepatitis B within the nail salon workforce. Next slide, please. So one thing to keep in mind that I had discovered while speaking to a lot of Hep B United partners and speaking with Lisa and Swoon was that in terms of sustainability, the most sustainable programs across the country really had incorporated some kind of public health infrastructure into them. And this really allowed the continuation of these efforts to really have a lasting impact within these communities. And also the final thing that I had kept in mind was that knowledge doesn't always equal action. And so while education is very critical and important, and it really empowers individuals and communities, that allowing an integration into the public health infrastructure really allows that sustainability to really continue. Next slide, please. So first, in terms of the cosmetology board recommendations, I think the inspectors that go into the nail salons to really inspect the code violations or policy adherence can be really used as an educational resource where they can provide further education on why violations are occurring and to educate the nail salon owners on how to prevent future violations from occurring, because currently that's not how it works. The inspectors oftentimes are just going in, slapping on a fine and then going away. And then in addition to that, I think we can, many states can adopt a sanitation rating system, for example, using, much like we see in restaurants, like a sanitation rating of A, B, and C, to really showcase to the community and public that this nail salon is doing a great job at protecting the workers as well as the clients from chemical or biological hazards. And then finally, a further incorporation of multilingual resources and also licensing exams that can be offered to really really provide this a better service to especially the immigrant population, which has a limited English proficiency. Next slide, please. And so to go along with that, in terms of educational recommendations, I think a further emphasis on continuing education courses that it really incorporate, much like Lisa had mentioned, hepatitis B education and infectious disease control provides really a great way to reach out to this migratory and this workforce that has a very high turnover. And then also incorporating Hep B into the licensing curriculum, specifically stating that Hep B should be incorporated into the curriculum. And then finally, utilizing multilingual educators and materials to really help and to further engage with these the trainees and teaching them the most effective means to prevent infection transmission in their work environment. Next slide, please. And then as a final recommendation in terms of vaccination, I think we see a very successful community-based approach in Tacoma Pierce County that Swoon had mentioned, and also with the California Healthy Nail Salon collaborative that Lisa had talked about. And in terms of partnering with having these community-based organizations partner with their local health departments, partner with the State Board of Cosmetology, and partnering with nail salons to provide further education, testing, and vaccination provides a really effective means to protect all their workers and clients from transmission in the workplace, then also transmission within their own communities. So we should really incorporate further discussions that involve all community stakeholders to really alleviate any fears or mistrust in the government that oftentimes we see within immigrant populations. Next slide, please. And then as a final note, OSHA does actually have policies that require an employer to offer the Hep B vaccine series without charge if their workers are likely to be exposed to blood or other infectious material. And I think we can all agree that the nail salon workforce does fall under this category. And so educating the workers and also the nail salon owners about this policy can help alleviate some of the burdens of cost to this population. Next slide, please. And so to conclude, we see that there are very sustainable programs that we've seen within the California Healthy Nails Salon program and also in the Tacoma Pierce County Department of Public Health, where they're able to really effectively provide Hep B education, screening, and linkage to care. So if those can be replicated across the country, that provides a very effective community-based approach to this issue. And then finally, further state-level advocacy is really needed to address these areas of institutional discrimination where they're occurring.
Great, thank you, Eugene, Lisa, and Soon for this very informative presentation. I think based on the interest of our Hep United partners, hopefully this is just the beginning of a continued discussion we can all have to learn from each other's strategies and findings in different parts of the country. We did get a lot of really great questions throughout the presentation, so I'm just going to jump right in since we only have about 6 minutes left. The first question I think was directed towards Lisa. Do you typically offer the trainings on site? And since workers usually do have the long hours, did you find that the trainings that you offered, were they heavily utilized? And I think to go along with that, what were some of your biggest challenges?
Yeah, definitely. I think, you know, a lot of the challenges that Swan also mentioned in terms of needing to be flexible around the worker schedules, definitely meeting them before earlier in the week when their salon's not as busy. You know, the season makes a big difference, how the weather is outside. Some salons are open from 9 a.m. to 8 p.m. So when are they available for a training, right? And so, you know, we definitely have to be flexible around the worker schedules. And also for us, you know, folks are commuting. They may not live in, for example, Santa Monica, but in fact, they live an hour away from Santa Monica, which is when they live in Little Saigon. And so where are we going to offer training? Closer to their home, closer to their work. It depends on what what part of the program our training is for. So for example, for the Healthy Nail Salon Recognition Program, the training is mandatory to join the program. So the owners actually require that their workers and themselves have to attend. And so we offer the trainings in their salon and we schedule it at a time that's convenient for them. Like I mentioned, sometimes, usually it's like in the morning before the salons get too busy. Sometimes they are able to arrange so that workers and everybody is able to meet beforehand. If needed, you know, if everybody's not able to be there, if all the staff isn't able to be there at one time, then we'll come back. You know, we'll come back and offer 2 trainings. We are definitely flexible to the needs of the community. We've also offered trainings at offices of our coalition partners. We've also offered trainings when we find out kind of a group of people still outside of the Healthy Nail Salon program. If we just want to offer free trainings to community members, we'll offer them to groups of people at partner organizations, at people's homes where they may feel more comfortable and things like that. So definitely there's a lot of trial and error in terms of understanding what works best for the community with the barriers. And, you know, obviously I think time and trying to schedule times is some other barriers and challenges we've had. Obviously, it's developing trust and relationships, similar to what someone said. Sometimes it'll take multiple visits before we can even talk about health and safety. You know, our outreach workers being, you know, doing outreach in Vietnamese, sometimes the first visit is just like, who are you? And where did your family come from in Vietnam? And, you know, can you, you know, some of them have approached our workers, our staff, and said, oh, can you help me translate this form I got? I don't understand what it means. You know, things like that. So really, really taking the time to get to know them and develop trust, and so that we could start to talk about health and safety and other sensitive issues.
Thanks, Lisa. The next question is for Soon. We had a couple people comment on how great your response rates were and the participation in your project. Did you have to incentivize people to come in, or did you find people were willing to visit the health department? And did you utilize any type of advertising to help increase participation?
So we rely on the current, I'm Vietnamese myself. So I'm with the community, and most of the people that I work with, they kind of know me. So we have the advantage there by using that current relationship to engage the people. So, so for example, with the council members, is randomly too, but also some I knew in the community. So that's why we sent out the letter invites to that 15 participants. But when they come, after they come, and then when we started with the council member, they just volunteer. They volunteer to be the engagement council because they see that this is important work. This is important because they themselves have families, friends, relatives who died because of liver disease. So they see this is an important issue that they need to participate. And then, of course, while they are doing the project, with the funding from the Hepatitis B Coalition of Washington, we are able to provide them stipends to help out with the mileage, with the time that they spend making the visits to the nail salons. So it just worked out very well in a way that we have a relationship, we have a partnership with the community already. I hope I answered the question.
Thank you. Another question was if this may be for Lisa or anybody else who knows of what's going on in different states, but does every state have some sort of a nail salon association? And then maybe specifically for Lisa, have you guys tried replicating or promoting the collaborative model or the recognition program model in any other states?
Sure, I can answer that, and then Swan, if you want to answer too. In terms of the nail salon association, some cities and regions have like a nail salon owners association. From what I know, in New York, they also have a union. Workers United has been organizing nail salon workers, and I believe they have Spanish. I mean, the demographics in New York are really different from California. It's really interesting. They have been organizing Spanish-speaking nail salon workers, and other organizations have been organizing Nepali workers, and I think that the union also just hired a Korean organizer and a Chinese-speaking organizer as well. So yeah, we don't have nail associations in California. I think that's something that would be really great. In terms of, what was the other question for me?
Oh, the other question was if the California collaborative model or the state recognition, the salon recognition program has been promoted or replicated in any other states. Mm-hmm. Have you guys done any of that?
I think other states have explored similar types of programs. Ours is a little bit unique because we're not we think it's an important program, and the unique part of it is that it's a really deep partnership with the county or city. And so, the counties and cities that we have it in California is San Mateo, San Francisco, Alameda, Santa Clara, and then the city of Santa Monica. And so part of it for us is really encouraging the government agency to own it, to own the program, so that they're putting funding into it, they're dedicated to it, they're putting staff time into it, so that they have more ownership over it. So it's not something that we're always pushing them to do, for example. And so other cities and counties throughout the country have called us, around asking about the model. What does it look like? How have you done it? So we have, if anyone's interested, we have published San Francisco Department of Environment that holds the program in the Bay Area. They have worked on a white paper, so actually detailing out what does it take to put together a program like this. So I'm happy to share that if folks are interested.
Kate,
Thank you. Yes. Go ahead.
For the state of Washington, what our county at first, we have this unique hepatitis B nail salon project, and that was since 2012. I am not aware of if there is any, there has been any other county health department that do the same project like us. I'm not aware about that. Since presenting our project, I hope that they can replicate our model, but I believe they tried, but not really successful. The thing is, you have to have an inside person to do the work and speak the same language. For example, nail salon workers are Vietnamese, and then of course you have to have the ability of providing the care and the tasks. All of our people, they would like to have the education and then free testing and then free vaccination. This is the big bang for the buck. Like my supervisor had said when we first, after we started and finished this project, this is good. This is a successful project, but you have to have the inside person from a local health department, for example, to be able to provide the free vaccine. And then you have to have the knowledge to work with the community members to go out there and do the work. So I mean, to answer the question, I'm not aware of any other states that do the same health nail salon project like us here in Pierce County. And I agree with Lisa too. It's just that, of course, I would love to see the state of Washington have the same thing like California, where Lisa does with the Nail Salon Association for healthy nail salon worker. That is good because from the association, the whole department can collaborate and partner and work with, among with together, we can make it happen, So educate, promote testing, and then vaccination. That's what I would like to see if we could do that in the state of Washington.
Thank you. I know we're a little bit over time, so if anybody needs to drop off the webinar, we are going to send out the recording so you can hear the rest of the conversation. But I did want to try to squeeze in one, maybe two more questions because a couple more came in. But so the first one is the education training provided in language in Vietnamese, and if so, does that get more of a response?
Yes. This is soon, I will answer that question. All of the materials, flyers that we brought to the nail salon workers all are in Vietnamese. We didn't want to alert the customers though. Sometimes if you come in and they are in the middle of the work with a customer, if the information you brought in and they are in English and it's about hepatitis B, customer could be alert about that and they will not like it. They will question, they will wonder what's going on. So everything we did in Vietnamese, in our language. And of course, they are Vietnamese anyway. So again, in Vietnamese language.
Yes, same, everything. I ditto everything that someone said for our work as well.
Okay, great. Well, I don't want to go too much over, so if people have additional questions, the ones that did come in, we will record them and share with the presenters so that perhaps you guys can connect offline with a little bit more detailed responses. But we did, if you did just send in a few more questions in the last couple of minutes, we do have them saved. But I want to thank everyone, the presenters and all of the participants for engaging in this discussion today and for all the great questions. Again, I hope that with the interest from Hep United partners, this may be an issue that we can continue to look at and provide resources and share information with each other as we learn about different initiatives across the country. So thank you all again for joining. And when you exit the webinar, there is a short survey that we invite all of the attendees to fill out. And we will share the full recording and the slides within the next couple of days. So thank you again to Eugene, Lisa, and Soon. And I hope you all have a great day.
Thank you. Thank you for having us.
Thank you.
Thank you.
Bye.